Good evening. This is Carlo Martuscelli, reporter with Politico Europe. You're watching a Politico event on healthcare systems after COVID-19. Turning on the television, refreshing our browser, opening up the newspaper, we're treated to now, unfortunately, familiar images. Hospitals are filling back up, patients are being hooked up to respirators, and the map of Europe is turning red as the coronavirus spreads. It had seemed that we'd escaped the worst of it, but once again, we're forced to deal with restrictions to our movement and daily life, with lockdowns on the horizon. And yet, despite this dramatic situation, we're also forced to look ahead, to when the virus is just a memory, or at the very least, to when we return to some kind of normalcy. Some experts say that at least part of the reason we find ourselves in this situation is because we've neglected our healthcare systems for too long, underinvested in them, not paid public health the attention it needs. At the same time, the pandemic has dealt us a severe economic blow. Now more than ever, we need to make sure that the money we spend is worthwhile. And the EU certainly sees itself as playing a role here. One just needs to think at the EU for Health program, with its nearly €2 billion budget. That's a massive leap compared to what was planned before the pandemic. And President of the Commission, Ursula von der Leyen, has led the charge to create a European Health Union. Maybe some of our panelists later can talk to us about what this means. The role of the World Health Organization has come into focus, not without its critics. It's trying to coordinate between the world's governments to make sure everyone gets the adequate care they need. Now that health is in the limelight, we can bring everyone together, from the politicians to doctors to patients and the industry, to talk about what we want the health systems of the future to look like. First of all, I'd like to give a big thank you to our partner, Janssen, for making this virtual event possible. And of course, thanks to everyone who's watching us online right now. I want everyone who's watching to ask questions via sly.do using the hashtag PoliticoHCSystems. Go to Slido from your computer phone, that's slido.com, and use the hashtag PoliticoHCSystems to ask your questions. So first, just to test out the system, we have a poll on Slido, and that's the poll is, do you think the COVID-19 crisis will benefit or hurt healthcare systems in the long run? And you'll see that there's 4 options you can choose. So please go and vote, and also ask us questions. We'd like to make these events as interactive as possible. And also tweet using the hashtag PoliticoHCSystems. Go on Twitter, let everyone know you're watching. And next, I'd like to welcome some remarks from our partner Janssen. We have Anouk de Vrouille on the line here. She's Senior Director, Government Affairs and Policy, EMEA at Johnson & Johnson. Thank you, Anouk.
Thank you, Carlo, and thank you for giving me this opportunity to introduce together with you this session of today on healthcare systems post-COVID. As you already said, the COVID-19 pandemic has and keeps putting our healthcare systems under enormous pressure. It is unprecedented, and we have never experienced this before. At the same time, the pandemic has cast a spotlight on some of the best elements of our healthcare systems: the selflessness, the dedication of our healthcare professionals, their inventiveness and openness to innovation, and above all, their willingness to collaborate in the interest of the societies they serve. Collaboration on healthcare between the European institution and its member states is another critical element, and you already also referred to that one. It will really be important to ensure seamless coordination of vaccination strategies between countries, as well as strengthening existing tools and agencies, such as the European Medicines Agency, European Centre of Disease Control, but also reflecting on how we can be better prepared for future pandemics. And I really hope the panel will help us to answer some of these important questions. It is exactly this spirit of open collaboration across borders and across sectors that will help us to build healthcare systems that are resilient and sustainable in the long term. In this regard, also the newly created WHO Pan-European Commission on Health and Sustainable Development, under your leadership, Professor Monti, will play a crucial role in giving recommendations on how to invest in health going forward. I'm very much looking forward to your perspective to ensure that governments will invest smartly in healthcare despite arising economic and budgetary pressures. Along the same lines, Mr. Rees, I'm very interested to understand how the European Union might use the pharmaceutical strategy to stimulate investment in innovative healthcare solutions. A clear signal is needed that collaboration between public and private sector is critical to innovation in healthcare, and it will benefit the European citizens. It will also be very interesting to hear the panel's views on
Oh, it looks like we had a interruption there. I'm sure we can get Anouk back on later to finish her remarks. But let's go then to the interview with Professor Monti then. Thank you so much for joining us, Professor. Just to remind the audience, you are chair of the WHO's Pan-European Commission on Health and Sustainable Development, president of Bocconi University, and of course, former Prime Minister of Italy. Thank you so much for joining us, Professor. My first question is on your latest role, your role as chair of the Pan-European Commission on Health and Sustainable Development. Now, we know that the Commission is aiming to produce a final report by September 2021. But beyond this stated goal, and obviously without anticipating the final outcome of the report, do you have any hopes on what the Commission can achieve?
Thank you very much, Carlo. It's a pleasure to be here at this political debate. And of course, I have some hopes. It was a big surprise to me that I should be asked by WHO to serve as chair of this commission. But then the surprise was overcome when they explained to me what they wanted to achieve. And then this motivated me enormously, because what they had in mind in setting up this particular commission was not to find the best way to counter the current pandemic, or the best way to get to a vaccine soon. Obviously, they would not have called on me for those tasks, but they wanted to put under the attention of everybody, and this is our task, what should be done, could be done in the future to achieve several things. One is to reduce the probability of pandemics, of new pandemics. Another one is, should they occur nevertheless, how to be more prepared, not just at the moment of the explosion, but in terms of the structure of the health and social care systems. And this implies a number of extremely interesting issues that we are going to explore. Let me just give you a couple of examples, Carlo. One is the international governance of health and of pandemics in particular. we are at a time when, at least in some countries, the willingness to have more global international coordination to cope with whatever issues is at an historical low. Let's think of the president of the United States, for example. On the other side, it's crystal clear that this pandemic has showcased all the weaknesses that derive, very serious ones, which have brought to human losses and to huge economic losses because of a badly insufficient coordination in the handling of the pandemic. And this is
sorry if I interrupt you there, Mr. Monti, but on this question of weaknesses, I mean, is this commission, do you think this is going to be a commission of kind of sweat and tears? This is going back to the question we asked the audience. I mean, do you see this pandemic as having to result in sacrifices, and your commission will highlight some of those sacrifices we'll have to make in the future to make sure that something doesn't happen again? Or are you more optimistic that these, in fact, the changes you'll end up proposing won't necessarily, can actually improve citizens' lives without just being renunciations?
Well, that's a tall order, but we will have, for example, to see how to make the fight against climate change felt more urgently by our governments and our peoples, and linked, as many scientists do see it being linked, to the health issues and to the pandemics. So we have to mobilize through accurate reasoning and an appropriate pedagogical effort at the end of the journey. We have to mobilize energies, resources that are there in our societies that would probably never have been trigged in the direction of taking care of the environment, not neglecting the animal and wildlife dimension of our planet. So, in a One Health perspective, so that we hope to give a little or large multiplier to many other political efforts that are with great difficulty going on. Let me just conclude by saying, for example, the international governance of health. This is something that is painful for governments, because all governments are attached to their sovereignty. But in a juncture where they see better than ever in history that it's only the appearance of sovereignty unless they coordinate more, probably having them coordinate more will both expose us all to lower risks of pandemics, and at any rate allow us to cope with them in a less costly, including economic and financial way.
So it sounds like maybe some sweat and tears, but also some benefits or smiles as well. Now, a question about politics. You've been appointed by the WHO. This organization has come under some criticism lately, for example, for how it handled its relationship with China during the initial outbreak. The Trump administration has, of course, threatened to withhold funding. How do you see the future role of the WHO, and do you see it as diminished going forward, or do you think it's just going to gain in eminence from the recent pandemic?
Well, first of all, this commission has been set up by WHO, in particular its regional department from Europe, with the strong support of Dr. Tedros, the Secretary General. Having said that, it's a totally independent commission. WHO provides us, of course, we do this pro bono. It's not a remunerated activity. WHO provides us with all the necessary scientific and other support. I would not rule out that, for example, in our set of recommendations on which we are working already on how to improve the international governance of health, there might be some recommendations to the WHO leadership itself, and of course, the recommendations to government, etc. And we know that for any international organization to perform better, and there are no limits to improvement, a set of conditions have to be there, including the willingness of member states to put the international organization in the conditions to work better. And so this will certainly be, I mean, we have not been set up to reform WHO, but as we look to the international governance of health, it may well be the case that we have also some recommendations for WHO.
Well, the WHO should watch out then. Now I had a question about economics. There seems to be some rethinking afoot that, at least in some quarters, that we may have more fiscal space to spend than previously thought. But at the same time, it's a demographic reality that Europe's populations are getting older, and this means more spending on health and social care. Do you think it's inevitable that we'll be forced to choose between healthcare spending and other priorities in the future? Or in other words, is it health or growth, or can we have health and growth?
We need to have health and growth, and even more, we need to have health and sustainable growth, which is not easy. But as we move on, you're not going to get one or the other. You either get both of them or you get neither, I suspect. And this case of these pandemics show how health can be well, it is a necessary component of an harmonious and uninterrupted growth, and how when something serious happens to health, this can be the most devastating economic input for the negative after a war, or maybe, who knows, even more than a war. So that one of the lessons of these pandemics is that, for example, when budgeting, when the political authorities in a country decide on a yearly budget or on a 3 or 5 year budget, they will have to reflect much more than in the past about what to do in terms of health, because many terribly negative events and terribly costly events financially can occur if health is not adequately taken care of, which does not mean that all other items in the budget should give in, of course, but we will probably need to develop also new methodologies of budgeting as to incorporate in our yearly budgets a sort of an accounting for future negative and costly event that may well happen, although it's extremely difficult to foresee when. This goes also, of course, for the damages deriving from climate change. So this is a terribly costly and tragic, but terribly useful in its own way, opportunity to rethink the way we in politics behave for the future of our societies.
On that question about the future of society, I have a question here from the audience, which is about a topic you touched on, which is climate change and the environmental challenges we face. And the question is, what can national healthcare stakeholders do to address the environmental challenges that the audience member says ultimately lead to health threats like COVID-19?
Mm-hmm. Well, I'm not in a position to give you an immediate and persuasive answer, but I would like, if you allow, Carlo, and if Politico agrees, to see this little exchange of views that we are having also as one of the hearings that my commission will intends to have with different stakeholders, experts, governments, and so on and so forth. So elements, ideas, and questions coming in this context will be extremely helpful to us, and I would be grateful if Politico could gather also, not only today, these questions and channel us to us. The stakeholders in national health systems probably can do a lot in order to reduce the likelihood of occurrences like this one. I believe in helping create awareness about behavior, but also in contributing to the reshaping of our health systems. For example, I hear that almost everybody says that to cope with events like this one, our health systems need to be stronger in their territorial, peripheral component. And so this, of course, will require a lot of attention, a lot of cooperation by all the stakeholders of national health systems.
You have a long history of working inside the EU and the 27 member states, but in this new role, you'll be working with the wider European region. It is a pan-European commission. And that also involves countries like Kazakhstan, Azerbaijan, Israel. Does this involve a different approach to the one you're used to? And what do you know about how these health systems of these countries are coping at the minute?
Well, this, I must say, is one of the most challenging and interesting elements for me, because I've been working, as you said, for 10 years as a European Commissioner, and then I was involved in many other EU activities over the years. So I can pretend that I know rather well the 27, or at least I know a bit about them. But the rest of the WHO Europe region is equally interesting, if not more. And from what I begin to see, the conditions of the health systems are on average well, less advanced than in the western portion of Europe. And it is, I would say, particularly important to use this opportunity of working at 53, because 53 is the number of member states of WHO Europe, so as to see best practices, spread best practices, and why not I mean, the political relationship between the EU and Russia, the Russian Federation, is not at a very glorious moment. But if one were to identify aspects of economic and social life where maybe in some form a much higher degree of integration than existing now between Russia and the EU could conceived, well, couldn't that be health?
That's an interesting thought. So health could be a way to bring Russia and the EU closer together. I have a question now that ties into your experience as Prime Minister. I remember during the debt crisis in Italy, our eyes were glued to the BTP Bund spread as it ticked higher and lower. Nowadays, we nervously watch COVID-19 cases rising. Are there any lessons from that financial crisis to this health crisis?
Yes, you pointed, Carlo, to a striking verbal similarity, because the headline of that financial crisis was the spread. People did not know very widely what a spread was. That is the difference between interest rates of two countries was before that crisis. But now, here again, we are dealing with the spread, the spreading of an epidemic or pandemic. So that is the similarity. Also, by the way, in the other financial crisis, there was a serious risk of spread in the current sense, not simply in the older one of difference between interest rates, because there was contagion, and financial crisis moved quite freely between one country to the next. And for example, when after the problems of Greece, Italy, which is of course a much larger member state of the EU and the Eurozone, came under attack, what we had to do in Italy was really followed with a lot of concern and interest everywhere, because I remember the president of France of those days telling me, we will support you, you must be strong and you must make it, otherwise the next element in the domino going down will be France. But so these are the analogies between the two crises. The main difference, I think, is a moral difference. In the sovereign debt crisis of 2010, 2012, there were clearly the guilty guys and the non-guilty guys. If Greece had that phenomenal crisis, it was certainly to a large extent because the Greek governments of the previous decades, not just years, had not behaved very effectively, sometimes very honestly. Whereas Germany and the other countries in the north of Europe were seeing Greece and others in the south as being, well, guilty of their own unfortunes. So that the idea of mobilizing the EU as a whole, the idea of giving concreteness to the principle of solidarity, etc., which have come this time, simply could not come, especially in the German mindset, where sin cannot be, I mean, should go through some sort of punishment. So we have seen Germany that time being a very, very tough and difficult element for the solution of the crisis, to some extent rightly, as I said. But this time Germany was at the forefront of the movement of solidarity. So the person was the same, Mrs. Merkel. Of course, she was much more mature politically this time. I can tell you how difficult it was, although in the end it was done, to persuade her to move in 2012. This time she has been the engine of movement.
Well, if Mrs. Merkel is listening, I'm sure she'll appreciate that. Thank you so much, Professor Monti, for your time. It was great to speak with you.
Thank you.
I've been told that Anouk is back on the line, so if she wants to just finish her remarks, and then we'll move on to the panel.
Thank you very much, Carlo. Thank you very much, Professor Monti. And I'll try to be brief, because with the digital challenges, I don't want to be cut out again. But maybe just 2 points that Professor Monti also mentioned. The first one, that we need both health and sustainable growth. It would be very important to reflect how can we then ensure we spend and target on interventions that deliver the greatest value. And I hope that maybe some of the recommendations that both the European Commission and the WHO Commission will be working on will reflect on that. And then secondly, on your point on international collaboration between the public sectors, obviously, but I think also here the private sector can play an important role. And definitely within Janssen and Johnson & Johnson, we are very eager to partner with governments and other stakeholders, sharing our expertise in science and medicine, because I think only together we can rebuild our economies and make sure that our healthcare systems deliver the value that they need to bring to the citizens. So maybe just to conclude, I really hope that, in some years from now, we will all look back at this very strange periods of the pandemic, and hopefully we will not have a new one hitting us quickly again, but that we look back and that we really say this has been a turning point. And the legacy will be one of collaboration across sectors, across public and private sectors, where greater trust has been created between those partners. So, I really want to stop there and give the time to the panel to continue this very fascinating discussion. And thank you very much for allowing me back in. I was able to follow Professor Monti's intervention the whole time. So thank you.
Thank you, Anouk. So now we have the panel discussion. I'd like to welcome all the panelists, but before I do that, I just want to remind the audience, ask questions on Slido, because we will be taking your questions throughout the discussion. So I'd like to introduce Marco Greco, President of the European Patients Forum, Andre Rees, Director for Health Systems, Medical Products and Innovation at the Directorate General for Health and Food Safety at the European Commission, Ilka Wolfe, President of the European Social Insurance Platform, and finally Judith Hiepe, Director of Nursing at Charité, a hospital in Berlin. So welcome everyone. I thought just to start, we could go around really quickly, yes or no, to the Slido poll that we'd asked the audience. So as a reminder, the poll question is, do you think the COVID-19 crisis will have beneficial or will have negative effects in the long term? So Marco, if you want to start.
I hope it will have beneficial effects. Otherwise, it will mean we have not learned anything from it. So,
great, thank you, Andre.
No, just simple answer. We cannot lose this crisis. You have to build on the crisis. This is also experience from the past in the EU. We always learn something from crisis, and we build up after the crisis.
Ilka.
Yes, I would also say we should always learn from a crisis. So there will, of course, be beneficial aspects, but I think there will also negative aspects when it comes to social security systems, because there will be a financial impact. But I think we will talk about this later.
And finally, Judith.
Well, we did face loss that was sad, and yet, like in many pandemic situations human mankind faced before, I think that in the end it is up to us to take care that we learn from the lessons we are receiving right now. And therefore, I do think there are both sides to it.
Great. Thank you. And Judith, I thought we could start the discussion with you. If you could just paint us a picture of what you're seeing in Berlin right now. Obviously, you're there, you're at the front line. We're seeing these dramatic scenes throughout Europe. This discussion is about sustainability, among other things, and long-term sustainability. But what's our short-term sustainability looking like right now?
Well, I think that in spring, Germany was in the comfortable situation of having enough acute care beds. We had good technology, and even the staff, the nursing staff, was sufficient. And so we hopeful, full of hope, we went into the summer, and I was hoping very much that we all could return back to the lives we had before. But now the situation has changed, and of course many of us expected this to happen. We are stuck within the second wave, and the numbers are increasing at a dramatic speed, And even in Germany, we are looking at the number of acute care beds with increasing worry. And I do think we depend on collaboration within our city, within Germany, but I'd also say within Europe.
Thank you. It sounds pretty dramatic. I mean, all of this care and this work that's being done, it costs a lot of money. I wanted to ask Ilka, I mean, when this pandemic is over, whenever that will be, are health systems going to be able to recover from this blow? I mean, financially speaking, among other things.
Yes, thank you, Carlo. I mean, when we are talking about the sustainability of the healthcare systems, we should already start from the state of play. We have the demographic change, we have increased life expectancy, and this is, of course, a major achievement itself, but it makes already pressure on the social security systems. Due to demographic change, the demand for the long-term care will increase, as well as the public expenditure on pensions. And of course, we will have a shrinking work population. And now on top, we have the COVID crisis, and COVID-19 is, of course, increasing the costs for medical care, and that is why it is affecting the social security systems, particularly the health systems. But it's not only the costs for the medical care. We will have, and it started already, we have an increased financial burden resulting from the unemployment. The allowances, the sickness and care allowances, they are rising. So that means we will have a financial impact. And that is why what I wanted to say already before, when you asked the first question, we now have to react and we have to do something. We have to invest. And that is why we really welcome the upcoming EU for Health program. And this was drafted in the context of the most challenging cross-border health threat the European Union and also the healthcare systems have ever faced. So now this program, at least at the moment, is intended to provide financial support to the healthcare resilience. And this is, of course, very important. And investment on health is necessary to build the social resilience and foster growth. And I think was already Mario Monti who said it before.
Yes, thank you. And on that topic of EU for health, but also the pharmaceutical strategy, drug pricing, I mean, Andre, it seems like the European Commission is very much aware of these challenges that Europe is facing in terms of making the healthcare system sustainable. Can you tell me a bit on what strategies you're working on to ensure that we can maintain our level of healthcare going forward and even hopefully improve on it?
Of course, we should see limit of the EU work. We should not forget that the healthcare systems are in hands of member states, but there are also EU level developments. I will refer first to the situation when the first time in the history of Union, all member states got the country-specific recommendation as a part of the European semester. So this was quite unique that the crisis, as already in spring, generated number of messages, but also worries about the sustainability of health systems. So this is why we put those recommendations to all member states, because everyone has all kinds of problems, starting from the way the integration of the system was done, the link between the social and healthcare sector, the way digitalization was imposed. So there were some issues, to reflect. Secondly, we are able to generate the fund which is available to member states, recovery fund, which recovery and resilience fund, which now we'll see, how member states decide to use this money to invest in health. So we will see this in coming months. There were money allocated from the structure funds to be used, in the relatively quick way to support the health systems on grants during the current wave of pandemics. And finally, I think we are preparing a number of strategic legislative measures to help with a number of issues. We somehow COVID put a light on difficulties we have already seen in a number of sectors, including pharmaceutical sectors or cancer or simply the way we are working.
I have quite a direct question now about one of those many initiatives you just listed, and that's we're expecting an impact assessment on orphan and pediatrics drug legislation. We know that some of the exclusivities tied to these designations can sometimes raise the price of drugs. So that's why I'm asking about it. Do you know when we might expect that to be published?
Yeah, we are finalizing work on the strategy. Also, the part of in the same package, we hope publish the impact assessment. So this will be next 5 weeks. We will publish, and there will be momentum to first get comments to the proposal of impact assessment, because it would drive the next phase, which is impact assessment itself.
Great, thank you. And Marco, I want to take a question from the audience here, because I've seen a few on the same line, which is just what do you see as the future of hospital care for patients? And the reason why I'm asking you specifically is that obviously during the pandemic, we've had this situation where maybe patients preferred to avoid hospitals, get treated at home as much as possible, or use telemedicine. So I wanted to know if, in your opinion, it would be a step in the right direction if we reduced our reliance on hospitals a little bit and looked more at things like home care and telemedicine and more territorial medicine.
Resources, when we speak about healthcare, are always scarce by definition. This is the first lesson you learn when you start advocating for patients. So for many years now, patients' organizations have been pushing on the necessity of the development of health systems like virtual consultations, patients and professionals using online tools, physician access, for example, to health records from offsite, home delivery of treatment, always in the perspective of being more efficient, of saving resources that can be destined to the development of the healthcare system in other rooms. So this is unfortunately not yet there. Too few patients with chronic conditions are benefiting from these alternative solutions. This pandemic has shown that what we were advocating for in this case was correct. I mean, if we would have implemented this 10 years ago, we could have had a better set of instruments for reducing the impact of the pandemic, for example, on chronically ill patients. Because what's happening here, and we are all aware of this, is that while hospitals and the healthcare systems are obviously struggling for facing the pandemic, we are creating at the same time a damage that we cannot even foresee completely for the future, because we are not doing prevention as we were doing in the past. Chronically ill patients are experiencing troubles and obstacles in accessing their usual therapies, and so this is detrimental for the treatment continuity, for example. So it's clear that we need to use these as a learning moment. We need to improve from this. And from the patient's point of view, this is somehow obvious, because the first thing you learn when you become, for example, a chronically ill patient is that you get diagnosed. It's a terrible moment very often, depending on the condition. And the first thing you have to do is to learn how to move forward with that. You have to learn the new situation and to learn and to develop new skills. So what we are seeing here is that this should have been already months ago, a great opportunity for developments and learning. This is not happening everywhere. This is happening somewhere. We are learning from this, but we need to make it wider somehow. The other issue, if I can conclude on this, is that here the point is also to maintain and to develop a patient's involvement and engagement in order to achieve real empowerment and participation as a key for a real quality care. This is not happening. Patients' organizations have been struggling over the last months for being invited to many decision-making tables during the pandemic. This could have, not involving patients in this situation has led to mistakes, or to the necessity, for example, of finding solutions that could have been already delivered easily, learning from the experience of patients.
Thank you, Marco. We've heard from the patients here. Judith, I wanted to know from your perspective, and here I'm taking an audience question, what do you think we need to do to make better use of healthcare professionals like nurses and community nurses and social care? What are we missing here?
Well, I think I was asked very often, don't I think that the pandemic would help my profession to a different form of reputation, like we are very relevant for society now. I think it is evident that we are relative for society, and it is amazing for how long a time in all of Europe we just saw one great way of saving money, and that was by reducing healthcare staff, and it resulted in a very, very difficult situation. And the lack and shortage of nurses, that is a problem you see all throughout Europe. Now, thinking of making nurses stay in the system of giving comfort to patients, it is essential that we have ways that their career can develop. So I think it is essential that they have possibilities to specialize, that they can take care of outpatients, they can take care of any form of psychosocial caretaking, and they can do it on their own. And I think the healthcare professionals and the nursing, it is my great worry that after the crisis, people will then again reduce staff, and we are stuck again in a situation like that. And I think the opposite is the case. You should invest more into nursing, so that the next crisis we'll have enough acute care places for patients and enough and a greater capacity of healthcare professionals.
Thank you. We've spoken about people. I wanted to speak about technology now. And Ilka, this is a question for you and for the whole panel, of course. Is technology just an investment? Is this just money we need to spend, or can technology help make our health systems more sustainable?
Yes, I think, we saw digitalization and the use of technologic means was scaled up by the digitalization, because we saw we had remote consultations, the e-prescriptions were used more and more, and also our members, they implemented very quickly new measures to help our insured to have quick access to healthcare and to find quick solutions. So for me, or in our point of view, digitalization can also help to reduce the costs of the expenditure for the for healthcare. So if well designed, the deployment of digital solutions applied to healthcare can also facilitate the access to the treatments and improve overall healthcare sustainability. So I think this is quite a good instrument to make our systems more sustainable.
And Andre, I'm going to just take that question. I saw that you were actually about to raise your hand, and I'm just going to ask it right to you unchanged.
You said technology people. For me, the technology doesn't work with people. I mean, both patients and healthcare providers, doctors, nurses, should understand how to use technology and where is the limit of technology. Digitalization is a great achievement. Somehow, not just in healthcare, we do this in the conferencing now, we have in education. So across the world, the working method changed because of availability of digital tools. But coming back to the way we should interact, this is important that we use as many tools, but we can use them only if they exist. It was clear during the especially first weeks of lockdown that those countries, they had already e-prescription system in place, simply were able to deploy the e-prescription easily to the patients. This works in the pharmacy settings and so on. But we also found all kinds of troubles. One of them was the interoperability. Data, we see this, for example, the way we are gathering data about the COVID itself was very difficult to standardize because everybody approached this in the beginning differently. Now, I think slowly in Europe or globally, this is more coherent approach. But at the same time, we have seen it's possible to, for example, discuss how track and tracing apps can work together. We're able during last weeks and months to agree the establishment of the European gateway, to allow, apps to be recognized. The first country started beginning of the last week. Now more coming in few days and weeks. But how to get to the interoperability in these tools was very, very difficult. But thanks to people who were working together, thanks to technology, we were able to do it. So technology works if it's working for people and with people. So, and we should not forget it's not about only digital. I give example, the home care. For example, access to the oxygenator today when patients need to get oxygen because of COVID situation, those devices could be available and can help reduce the pressure on hospitals.
I think I saw Marco raise his hand. Did you raise your hand, Marco?
Yes, just I'd like to echo what Andreas just said. Technology is an important instrument. It can be a great instrument, but it will not be the final solution to every problem. Technology needs to be accessible. That means that has to be cost efficient. Also for those that has to access to services through technology. It requires education that we are giving for granted sometimes, but not the entire population is not entirely digitalized or technologically educated. It shouldn't become a barrier for the aging population, but it should become a resource for the aging population. And technology takes with it the enormous problem of data management, data handling, and data property. So we have to be very, very aware of this, because somehow what's happening is also taking away the attention from the issues on that were raised and partially taken by GDPR that are still there.
I mean, that takes us very naturally to a question from the audience that is right on this question of data. And Marco, I think you touched on this, but how can we make better use of real-world data and evidence to improve healthcare systems? And how can we move towards outcomes-based models if that is what we want to do? And I'll open this up for the whole panel if anyone wants to jump in.
Oh, I maybe, since we see COVID as a trigger, that what we did, is I think interesting, maybe not to bigger audience, that we're able to establish thanks to cooperation with the blood services from member states, with the blood associations, with the researchers, the database which is collecting data on the use of plasma for convalescent plasma for treatment, and this is kind of experiment real world data. Of course, simultaneously we see the number of clinical trials going on, but for sure in the future we have to invest more in this field, because this is one of the approach we are taking, building up the European health data space. This is the way European Medicine Agency and head of medicine agencies established a program called Darwin to generate more data. But how this will be used in the future, of course, we should always think, how this can benefit, different patients groups or different decision makers like payers or health technology assessment, but also simply help to see the potential risk of different treatments on which is offered by medical devices or pharmaceutical industry.
Ilka, do you think we should move to an outcomes-based model?
Oh, this is a difficult question. I mean, when we are talking about real-world data, what you mentioned before, I think if they are well designed, they could provide more evidence when it comes to effective pricing and the reimbursement decisions of the medicines which is made at national level. So this is what I would say on this topic. But if not, we do not have a position in detail on this.
Sure, no, I understand. I have maybe a slightly controversial question for Judith, actually, which is we often speak about how we should center patients more. You're on the other side of that. You're treating the patients, and they're not always easy. Do you see this as the correct approach, that we need to give patients more of a say in our decisions in healthcare systems?
Well, actually, I'm totally amazed at saying that I'm at the other side. I've been a nurse for 32 years, and for me, the patient was always the center of my action. And without the patients, I wouldn't have lasted for 32 years in this profession. So, of course, it is the right way to empower the patient, to make decisions, to get him involved, because patients do want to be involved and they want to get involved. And I think it is our task to make that possible.
Thank you. Marco, I'm guessing that must be music to your ears.
Yes, first I want to thank Judith, because she has expressed in a very nice way and very clear way what we have been advocating for decades. And it's not a case that this is coming from nurses, because it's essential to create a cooperation there. Patient centricity doesn't mean that the patient has to take all the decisions alone, but the patient has to be there discussing the decision that will be taken about him, co-designing together solutions in order also to be more efficient. Real-world evidence, we mentioned before, that the essence of real-world evidence is to become more efficient, not only working on efficacy, but on efficiency. To understand the unmet need. If you don't speak with patients, if you don't put them at the center of the discussion, you cannot intercept unmet needs, and you cannot be efficient. A solution, a drug, an innovation is not useful if it doesn't reach the patient at the right moment and with the possibility for the patient for accessing it. The dialogue is essential. What we have been fighting for years for is the dialogue, is to have an open dialogue. And what Judith has just demonstrated is that when this is working properly, it's marvelous, not only from the human standpoint, but also for the results. We save resources. We better use the resources in this way. We're not wasting money.
Thank you, Marco. So, sorry, go ahead.
May I add to this point? There's also about the workforces and capacity to deal, with the problems. Now we see in this COVID that, as you already said in the beginning, we are in many countries, in many hospitals. My colleagues, because I'm still a medical doctor, and nurses and the paramedics, they are really on the edge of serving. What worry me, that when I see some results of number of studies, showing there is the kind of the willingness to leave the professions because of tiredness, because of difficulties, because of often salary income and so on. So. And I remember, in a few years ago when we asked the questions in one of the study, why you stay in the professions or you leave the professions. So always was the condition of work, the number one. It was no salary, but the condition of work. And now I think COVID showed that there are all kinds of difficulties to serve, starting from the beginning, the lack of PPEs. Later was the problem with the trust and the relations with the patients, how to serve without understanding the situation and the treatment options. And now, of course, we have tiredness because of the wave of patients arriving to the emergency units, calling doctors because we don't know what to do. So I think are learning that we need capacity to deal with the problems. We need to really build the resources to allow us, to serve. Because finally, in the best will in your 32 or 3 years experience in the field, you will serve the patients, but you will not serve if you can simply physically can get to the bed of the patients or pick up the phone, because they're calling every minute.
May I say a quick thing here?
Sure, yeah.
I will be very quick, I promise. What sometimes surprises me when we are having this kind of discussion is sometimes to get a question like, talking about patients as if patients were something different from us. One thing that is important to understand when we're discussing about healthcare systems is that it's something that at a point of our life, every one of us will access. Investing on healthcare professional, that is even more important. It's something we will all benefit at a point. And so it's difficult for me sometimes to answer to certain questions in which patients are somehow depicted as something aside from society or from the discussion. So as a group of people, that is different. We are all patients and we will become all patients. I'm sorry to say this in such a direct way, but that's why I've always been talking about investing on healthcare, because it's something that it means to invest on ourselves. And the point when it comes to healthcare professional is that this crisis has demonstrated that they deserve, has demonstrated more than ever, that they deserve investment on their professions. Because, it's fantastic to define them heroes, because they have been heroes. But it means also that something is not working well, because they have not been put in the condition of working in a normal way. So they've been put in the position of being heroes. That means also to accept the risk of making mistakes and so on. I'm saying this, I'm living this every day. My wife is an internist, so and she's now involved in a COVID department working on this, and I see that. I see the psychological impact on that. It's not only about the money and the rewards. It's about recognizing the importance and the centricity of these people.
Thank you, Marco. I wanted to step back for a second and go to the world of policy, and I wanted to ask this to you, Andre. And I saw that the audience had also asked this question, but I don't see it anymore, which is, what is a health union? What can you tell us about this concept?
What we understood, what I think also Professor Monti said, that we are, for years we were discussing, health is important, but now we understood this, as citizens of Europe, as member states leaders, as all stakeholders, that we are connected. The single market is impacted by health related issues. So the response which is proposed by our president, by the commission, is to try to kind of act together. And of course we are building up, the proposals in the pipeline already mentioned, by Anuka, the package on health threats and reform of EMA and ECDC role in this area. Cancer plan is coming to the EU Pharma Strategy. So all these, puzzles are interlinked. The EU like BARDA instrument. So we understood that we should respond, together to the health crisis, to the health problems, more than before. And I think that this is also what I think Professor Marti reflected in his interview with you.
Yeah, I mean, of course, the 2 billion euros in the EU for Health program that's been allocated right now, I mean, that's a big increase from what came before. But at the same time, we have to be honest, compared to the national health spending of individual countries, it is small. And I have a question from the audience here, and they ask, And sorry, this is from Anouk, actually. And she asks, is there going to be any coordination on the use of recovery funds in health? And are there smart investments that individual governments can make to deliver the greatest value? So I guess, there's a bit the contrast between the EU's EU for health and then coordination at the member country level. Does the panel have thoughts on that?
Maybe I can just shortly pick up this question and ask contribute. Now, for me, the of course EU for Health is as you rightly said, is much more money than you used to have in the health programs. But of course, this is relatively small instruments. Recovery fund, which is of course much bigger and but of course will be also allocated to a number of priorities of member states. Those programs will come to the Commission. There will be interaction between national programs and the Commission. And of course, we are starting this process. We will see in the near future how this will work. We'll also see how much investment in health is planned, but we should also remember this is the priority of individual member states, competing priorities in many fields. But most probably we will see a number of health investment also in those programs.
Does anyone else have anything to add to that?
I would like to add a point. I think that we need to somehow to start from this in order to end the debate on whether health is or not within the EU competence. It is. So I think we should start talking about how this will be developed rather than, again, if. The point is that healthcare is very European. It's one of the most European things we have, simply because health is a common language for European people. It's something we all understand. When we are ill, we are the same. The pandemic is showing in a very clear way that doesn't care very much about, it doesn't check the passport of the patients. No? So that's why from here we need to start building. I believe the EU for Health program is a very good starting point. If it will be kept like that, then we will see where the council is going. That is another point of discussion and that raise attention. From here, we need to start building. It's clear, Professor Monti made it very clear, every country is really jealous about its competencies. But if we don't start thinking about healthcare as a European matter, during a pandemic, we will lose the biggest chance that Europe has had in the last 10 years for showing how essential it is for its citizens.
Thank you. Yes, please.
Yes, I just want to say I fully agree with Marco. The EU for Health program is a good start to take the money to invest. For example, we already had the topic. Also, Marco said it at the beginning: prevention. It's very important to invest in prevention and health promotion. But we can, of course, do much more, and that's already what the Commission did during the crisis. For example, create a reserve of essential medicine supplies. Or what we can also do at European level is when it comes to prices, high prices, they are also very crucial for health systems, and that's why we are looking forward to the pharmaceutical strategy. I think Andre he already mentioned it at the beginning, because affordability of medicines and also availability of medicines is a very important point for us, and it's really a priority. And we are very happy that the new appointed Director General of DG Santé already affirmed that it will be a leading principle. So when it comes to prices, we can also cooperate more on pricing and reimbursement in case of an for example, exchange of best practice. So I think we can do more at European level to tackle a crisis, but we should stay in the competences we have already for the moment. That means the member states, they are responsible, should remain responsible for the definition of national health policies, but nevertheless, we can do much more at European level. We can cooperate more. We saw it at the beginning of the crisis. So we were surprised. There was a lead of kind of solidarity. So I think this should already be a very first lesson from the crisis, and where we can do much more.
Andre, Ilka mentioned the pharma strategy there. Can you give us any preview of what's in it, especially when it comes to affordability, since that seems to be such a big link to sustainability in healthcare systems?
Of course, in the complex strategy, the boxes are interlinked. So we try to kind of find the compromise between the one hand, for affordability, which Elke referred, which is very, very important principle. See the patient's role in the system. At the same time, of course, keep development of innovative solutions in Europe, booster also the development of new products in EU, because at the same time we are part of the global developments, when we depend so much now from import of active pharmaceutical ingredients from Asia. And we would like also to strengthen our independence. So all this, putting all these vectors together, it's really one of the most difficult part of this exercise. But I hope, at least when I see in this current development with my team, with colleagues in the European Commission, across the Commission, because I should also stress, it's not DG Sound strategy. It's developed, with all Commission department, but also with input from stakeholders, from the public consultations and so on. So we hope we will find the right balance, but we should not forget strategy is just the framework. There's still work to be done, to change the system and see the results in next years.
Great. Well, thank you, Andre, and thank you to all the speakers for your time. I mean, if there's one takeaway here, it seems to be that that better healthcare systems are possible, that we're learning, but that there's a lot of moving parts here. And sometimes different stakeholders have different objectives. Sometimes they align very strongly, as we saw the case with Marco and Judith. They seem very much aligned on the importance of the patient in the healthcare system. And we learned more about the health union and this kind of holistic perspective, where we see various different parts of the EU's efforts in health, that while they might touch different areas, they seem to be converging on one thing. So thank you so much to all of you for your time. I'd like to thank the audience for participating, for their questions. And I'd like to thank our partner, Janssen, for making this event possible. Please do send your feedback to us, and you can reach us at events@politico.eu. We'll hold more virtual events this week, and you can check our website for what those events are. The website is politico.eu/events/future-events, politico.eu/events/future-events. So thank you very much for joining us, and see you again soon.